The following segment is sponsored by Providence Health and Services. This segment of Afternoon Live is brought to you by Family Matters.
Health and education, safety, and the quality of life. K2 and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because K2 and Providence Health and Services know that family matters.
Welcome back to Afternoon Live. Our next guest is on the forefront of cancer research, helping to create a personalized approach to treatments. Here to share more, we welcome Providence Genomics Program Director, Dr. Brian Pining. Thank you for being here.
Thanks, Anna.
Well, let's start with the basics of what are we talking about when we use that term genomics?
Yeah, so genomics, so your genome is the collection of DNA. There's about 3 billion bases of DNA that is basically your instruction manual for what makes you you. So your traits like hair color, eye color, how tall you are, that's all encoded in your genome.
How does this relate specifically when we're talking about cancer treatment and understanding more about a patient?
Yeah, so your genome, over time, kind of as we age, our genome accumulates what we call mutations. And they generally occur randomly throughout your genome. And so every cell in your body has its own unique copy of that DNA. And on occasion, randomly, cells gain mutations that cause that cell to grow and proliferate uncontrollably. And so when that happens at some place in your body, that's what we call cancer.
So when we can better understand on that cellular level what's happening, does that give us better information to create treatments and more options for patients moving forward?
Yeah, so in the case of what I do, so we run these very large DNA sequencers that sequence DNA at various locations in your body. And when a person has cancer, we sequence that tumor with the goal of finding those mutations, because there are new classes of therapies called precision therapies that are designed to shut those specific mutations down and then eventually hopefully cure that cancer.
Okay. How accessible is this kind of research and treatment here locally?
It's starting to become very mainstream, where it really kind of all advanced cancer patients should have access to DNA sequencing as part of their cancer care.
That's pretty amazing. It feels like there's so much progress happening so quickly. I mean, I know we still have a long way to go, but it's really encouraging to hear things like that.
Yeah, so this process has really had dramatic impacts on a subset of cancer patients where patients have presented with advanced cancer, and we've matched them to a targeted therapy, and it's really caused those cancer cells to shrink and go away.
That's amazing. Are there certain types of cancer that it might be more effective on, or does it matter?
It really applies to all types of cancer. We're focused on the individual mutations that are driving that cancer. And the approach doesn't work for every cancer type, but there's more and more of these targeted therapies coming available over time.
So when someone can get this personalized and super targeted approach, can it help them with maybe predicting some health outcomes for their future?
Yeah, so when you apply genome sequencing to your hereditary or germline genome, you can make predictions about your long-term health and wellness. And I expect that over time, your genome will become part of your health record that your physicians will go back to again and again throughout your life.
Are patients kind of glazed over sometimes when they're hearing this? Because it does sound sort of science fiction-y if you're not used to just talking about it all the time. It's pretty incredible.
Absolutely, and I don't think people really understand how much part of standard medical care this is starting to become.
Are there certain things that you're excited about, either in current research or where we're going in the future with this for patients and their health?
Yeah, so the inroads for precision medicine has largely been in cancer, but we're starting to see genomics make a strong impact in cardiovascular disease, in neurological diseases, and I think we'll get to a point where it's a standard part of all healthcare. That
is so amazing. Thank you so much for sharing all that with us today.
Yeah, thank you.
I think I understand a little bit more. We're going to keep the science lesson going. Thank you so much.
All right, thank you.
Okay, for more information about Providence research and treatment involving genomics, head to katu.com/familymatters. We'll be right back with more Afternoon Live right after this.